from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Good morning, everyone, and welcome to the Wednesday, February 27th edition of Good Morning Arkansas. I'm Kayla Lafferty.
And I'm James Bryant. Thank you for joining us. We've got a great show coming up. Of course, last few days of Heart Month, so cardiovascular disease is still the #1 killer. And in this month's Keep On Amazing, we are talking about, with Baptist Health, Dr. Keerthy Narisetty, and he's here with patient Vince Blubaugh to talk about cardiovascular disease and what we can do to bring about change.
So it's an important conversation to have, especially as we're coming up on the tail end of Heart Month. So It is a really, really important conversation to have, so that'll be a good one. Welcome back, everyone. Now, cardiovascular disease is still the #1 killer, and in this month's Keep On Amazing, we are talking with Dr. Keerthy Narisetty and Vince Blubaugh, talking about cardiovascular disease and just everything that is kind of encompassed in that and how we can hopefully bring about change. So let's start off talking. You were just explaining to me that cardiovascular disease is kind of an overarching term for a bunch of different diseases.
Yeah, so cardiovascular disease, we kind of try to get everything under one umbrella. So people who have congestive heart failure, people who have valve disease, people who have heart attacks, and people who have congenital heart disease. So this is a broad umbrella. And then if you go back to the history, since 1963, we've been waging a battle to try to bring down the death from the cardiovascular disease. So if you look at all the disease spectrum, cardiovascular disease is still the #1 killer in the United States and the world over.
Wow, that is, you think about so many people affected by that, that's pretty incredible, Let's talk about congestive heart failure in general. That's what you have, Vince, correct?
That is correct.
So let's talk about that process of how you got diagnosed.
Really, I had a series of symptoms which culminated in consistent or persistent coughing, and went to my GP, and they were treating me for sinus stuff and everything. Kept on going, and it finally got to where it was just couldn't sleep, it was unbearable, and went to the emergency room at Baptist, and 2-3 hours later found myself in the cardiac unit.
What was that like for you, getting diagnosed with something that is so hard to treat?
Well, it's pretty scary. I mean, honestly, it's just a total new experience for me. I've never had any medical problems at all. I mean, first time I've been in the hospital as an adult, so just really out of the blue.
And was his diagnosis, the process of that, a typical process? What it's like for people going through this?
So it's a very interesting question. Mr. Blubaugh had congestive heart failure, but the congestive heart failure is from what we call a non-ischemic cardiomyopathy. So he had a kind of viral infection back then, and he also has coronary artery disease, but the coronary artery disease is not significant enough to cause heart failure.
Okay.
So what we try to do is we try to figure out the cause first. So again, it's hard to tease. We have to do numerous testings. And once we got down to the diagnosis, we said, okay, we can work with this. Although, Mr. Blubaugh said it's a big challenge for him to accept that he has heart failure. And we were lucky enough to provide the help because Mr. Blubaugh was motivated to take an extra step to see what we can do for him. And once we identified the problem, we said, okay, we're going to make a commitment here. And Mr. Blubaugh was very open with us. We said we're going to make lifestyle changes. We're going to try to figure out the problem. We're going to try our best, treat you with good medications, and see if your heart can recover. And there's a saying in the congestive heart failure world, it takes a village to kind of take care of a single person. The first and foremost character, Mr. Blubaugh, is a character himself. So he has to show the motivation, which he has showed. And from our standpoint, you might be seeing me and Mr. Blubaugh today, but behind the scenes, there are physicians, there are mid-levels, there are nurses, a social worker, a pharmacist, a psychiatrist, a physical therapist. So there's a whole team that got together to work with Mr. Blubaugh. And this is just one example. And we have this team working every day, and it comes with a passion. And I'm lucky, as well as the Baptist Health is lucky to have a team with a passion to kind of really have a motivation to go and help people.
And what does that feel like for you, knowing that all these people came together to help you through this process?
Well, it's very encouraging, of course, very supportive. And any question you had, I met with a dietitian, met with everything else, and just everybody has their expertise, and if you listen to them and really be consistent in following what they do, it did, in my case, turned out very well. up to this point. So
that is awesome. And what is it like for people going through that process? What's the treatment like when it comes to congestive heart failure?
So we at Baptist we try to work from the bottom to the top. We have prevention, and we always believe in prevention. So how we can prevent? We have a preventive cardiology team, and once, for all practical purposes, we try to avoid people getting into trouble.
Yeah.
So we try to work with them. If they have diabetes, we try to make sure that the diabetes is controlled, blood pressure is controlled. But unfortunately, in situations like Mr. Blue Eye, we tend to see people have this congestive heart failure. We are prepared. We hope for the best, but be prepared for the worst.
Yeah.
So we have a whole bunch of services starting from preventive cardiology to advanced heart failure, where we have a congestive heart failure team. I just mentioned about the team that we have. We have an advanced valvular team that can take care of people who have valve issues with congestive heart failure. And we have a renowned surgeon who is recognized nationwide, Dr. Ransom.
Incredible.
Who has done the HeartMate 3 device. He's done a phenomenal job, and we were one of the top 5 centers in the nation to be recognized for doing the best.
That's amazing. Right here in Arkansas at Baptist Health. If you would like more information, you can call Baptist Health Helpline. We'll put that up on your screen for you if you have more information, or if you need more information. I just want to thank you two so much for talking about such an important topic, and also to you for sharing your story. I know that can be hard.
No problem.
Well, thank you two so much. We appreciate you a lot.